So progression on the shuttle, the next jump we're going to do is a bilateral grid jump. What she's going to do in this position, we got the shuttle divided into quadrants. We're going to jump from one quadrant to the next. This is a good exercise at working multiple planes, maintaining good joint alignment, kind of stressing the knee in different angles, more of a sport-specific type of activity. So what she's going to do, got the same setup, 60-degree angle. She's going to jump, and then we're going to start in a clockwise position. So she's going to jump and then land in the grid to the right, then jump and land in the grid down below that one, and then we're going to go in a clockwise pattern. So go ahead, Katie. So same mechanics, we're looking for soft landings, watching those knee angles. As we go through the phases, we begin to add more and more resistance on the shuttle, working our way up to body weight, which will begin in the next phase. Okay, so after 20 jumps, we'll have a reverse in a counterclockwise manner, working the joint a little differently. So after 30 seconds to a minute rest break, we'll have her go counterclockwise here, same manner. And that is the bilateral grid jump.
Here in Impact Phase B, the athlete repeats the alternating shuttle exercise completed in Phase A, entry-level plyometrics.
Same joint mechanics, landing toe to heel, keeping her alignment good and sound. The progression on the bilateral grid jump is moving that into a unilateral position. We usually do this on the surgical leg only. This builds confidence in the surgical leg, making sure that they're getting the power, the push-off that they need, and it also allows the patient to become comfortable landing and loading that surgically repaired knee. So she's going to do the same thing as we did before with the bilateral grid jumps in a unilateral leg position. So she's going to start clockwise. Go ahead. It's real imperative on this one to really watch that valgus angle at the knee. And if you find them doing that, then you need to correct it and make sure they're jumping with safe, sound mechanics. We don't want to hurt them. We usually start with 20 reps as well on this one. And that is a unilateral grid jump. The next progression in the lateral bounding exercises is 3-point lateral bounding in place. The mechanics are the same, but we're going to move it into 3 different planes of motion, challenging the balance and core strength of the patient. So she's going to get into her start position and move through the cones, keeping good sound mechanics all the way through, landing in that flexed knee position. After the desired time, we're going to switch the legs, and she's going to be pushing off her other leg. Switching the legs becomes more important as we add resistance, which is the next progression in this exercise. So this is 3-point lateral bounding in place. The next progression of the lateral bounding in place would be lateral bounding into rotation. The mechanics are fairly similar, but what we're going to do, she's going to move from the coronal plane to the sagittal plane all in one motion. We're going to load both legs equally. What she's going to do, she's going to shift her weight to the right and rotate her right leg forward, return into the start position. We're going to do this for 20 to 30 seconds. As she becomes more and more comfortable, more confident, we're going to have her go higher and farther with each bound here. Soft landings are key. Okay, good. And we're going to have her switch her legs now. So she's going to push off her right leg, and the left leg is the one that's going to be rotating into the sagittal plane here. Just watching knee alignment and that flexion angle. We always tell patients we'd rather them land too deep than too shallow. After 60 degrees of bend, it's nearly impossible to tear your ACL. Good. And that is lateral bounding with rotation. Some of the early agility exercises we start early in the phases, we use a step for. Usually we start our patients on a 4-inch step and progress that all the way up to a 12-inch step. This again is at the discretion of the clinician. The first exercise I'm going to have her do is what we call quick feet. She's going to step up on the step. It's almost a jogging motion, and she's going to repeat that as quickly, as safely as possible. So there's very minimal impact in the joint. We're stressing form first, then quickness. We usually start with about 20 seconds of this, and we usually progress in 10-second intervals along with the height of the step. So if she just went for 30 seconds, a good rule of thumb, we usually double or triple the time of the exercise for her rest break. So she's going to rest a minute to a minute and a half in between exercises. The next exercise we usually do is what we call the ollie shuffle. These first two exercises are all in the sagittal plane, so they're relatively safe. There's not a lot of stress at the joint. That's why we start with these. So the ollie shuffle, she's going to put one foot up on top, and she's just going to switch her feet back and forth. Once again, we're stressing form first, good alignment, then quickness. As she progresses, she'll start going quicker, getting as many touches as possible in the time frame. After that, we'll move into the coronal plane. We'll have her start to the side. We're going to do what we call lateral quick feet now. So she's going to put both feet up on the step, move to the right, and then both feet off the step. We want people to go nice and slow. Make sure your patients get the form before they try to pick up the speed. Soft landings are key. It shouldn't sound like a herd of elephants. And as she gets more comfortable, we're going to pick the speed up. Instead of repetitions, we almost always use time for exercise dosing here. The last exercise we do with the step is what we call lateral skaters. She's going to put the top foot on the step, and she's going to do a little hop and actually switch her feet. So one foot's on the turf, one's on the step at all times. That flexion angle on the top step is real important. If you see, she's getting below that 60-degree mark, which is super important for hamstring and quad co-contraction. And as we discussed before, your rest breaks are real imperative in this. If you do not let your patients rest, a lot of them will bonk, get sick, all of the above. And that is our entry-level step agility exercises. Starting in the second week of Phase B, a return to jogging program is initiated on the treadmill. The patient begins by walking at a brisk pace for 3 minutes. At the 3-minute mark, the treadmill is sped up to a jogging pace for 1 minute. This is usually somewhere right above 4 miles per hour. After this minute, this is followed with a 1-minute walk. After she has walked for a minute, we speed the treadmill back up and continue with a 3-minute jog. Once again, we follow the jogging portion with a 3-minute walk. And the whole time we're watching the patient's readiness to put weight on their leg, watching for any gait deviations, pain, joint distress, or any other abnormalities throughout the whole activity. Should the patient continue to exhibit good tolerance to this, they will end with a 5-minute jog and 1-minute cool down walk. Once it is evident that a patient is tolerating this well, a jogging program can be initiated at 3 times per week.